Good morning, everyone, and welcome to day two of EVA BC's 2022 Annual Training Forum. My name's Lynelle Halakowski, and I'm the other co-chair of EVA BC's Board of Directors. Sherry and I share the sharing responsibilities, and don't worry, you'll be hearing more from Sherry later today in her inspiring mini keynote in the afternoon. I'm also the director for Region 5 and the executive director for the Prince George Sexual Assault Center. I started out many years ago as a volunteer in the early 80s, and after many years of similar work in that region, more education, and for amazing children, I returned to the center in 1997 as an STV counselor, and then moved on to become the executive director. And here I am today. I always like to take a moment to honor the founding mothers of the Prince George Sexual Assault Center, Karen Hilland, Lorraine Hilland, and my own mother, Ann Halakowski. Without them, we wouldn't be where we are today. I'd like to acknowledge that the work of our organization, EVA BC, takes place across the ancestral, unceded, and traditional territories of many Indigenous peoples and First Nations. EVA BC's main office in Vancouver, where I'm working from today, is located on the unceded, ancestral, and traditional territories belonging to the Musqueam, Squamish, and Tsleil-Waututh nations. We are deeply grateful to be able to do our work and support anti-violence workers and cross-sectoral initiatives across BC on this stolen land. We are committed to reconciliation and recognize our responsibilities to support the implementation of the calls to action and the calls for justice, and to continue learning from a place of humility. It's a privilege to be hosting and learning alongside you this week, and I look forward to connecting with many of you throughout the year. We are grateful to the Ministry for Public Safety and Solicitor General for providing civil forfeiture funding, and also grateful to our community partners and corporate partners, Uber, who has also supported this event, and as many of you know, other initiatives in our work to end gender-based violence. Tomorrow, November 25th, is the International Day for the Elimination of Violence Against Women. It's also the launch of the 16 Days of Activism Against Gender-Based Violence. If you follow EVA BC on social media over the next 16 days, you'll learn more about several initiatives underway as part of this international campaign. Please do take some time to look at what's happening in your own communities as well, and the other voices of other organizations online. Just a few reminders. You'll note that there's live captioning. This is available during the morning keynote sessions and tomorrow to improve accessibility of the content. We encourage you to prioritize your wellness. We have support folks available to you during the training forum. And if you'd like emotional support, you can connect, we can connect you. Please visit the Wellness Center in the training forum platform and to see options for how to reach us for that purpose. If you have any tech questions or difficulties, please email atf@endingviolence.org. So again, atf@endingviolence.org, and a member of the team will be able to assist you. I'd now like to share a message from BC's Deputy Caucus Chair and Parliamentary Secretary for Community Development and Nonprofits, Nikki Sharma.
Good morning. It's great to be able to join you via video today since I wasn't able to join you in person. I'm speaking to you from the traditional territory of Lekwungen-speaking people, the Esquimalt and Songhees First Nation. I'd like to start by acknowledging the important work of Ending Violence BC, the work that they've done for over 30 years on behalf of people in crisis. A startling statistic is that 50% of women in Canada have experienced sexual or physical violence. And each year, 20,000 women in BC experience intimate partner violence. As a mother, I want my children to grow up to have healthy relationships. We know that a stable family environment is vital to children's well-being and emotional health. However, we also know that creating and maintaining stable family environments can be impossible to provide when partners are violent. Violence in any form is to be condemned and has a devastating and lasting impact on people, especially children. And we know that sadly, during times of societal crisis, gender-based violence such as domestic and intimate partner violence and sexual assault can increase. The COVID-19 pandemic resulted in heightened risks and more incidents of gender-based violence, as well as uniquely difficult challenges for service providers. Couples and families were in close quarters with fewer community connections during the pandemic. The challenges were increased for groups such as Indigenous women, girls, 2S LGBTQIA+, and other equity-denied groups who are already experiencing increased barriers to safety. And I know that many service providers saw dwindling budgets because they couldn't conduct fundraising efforts during the pandemic, despite an increase in demand for services. Our government has a number of initiatives to address gender-based violence through the Gender Equity Office and the Minister of Public Safety and Solicitor General. Government provided $44 million of annual funding for a range of services to support victims of domestic violence and sexual violence, to support over 400 victim service and violence against women programs across the province. Since 2018, government has been providing $8 million annually for ongoing demand of services such as counseling, outreach, and crisis support. And this year, EVA BC received $220,000 for the Be More Than a Bystander campaign. This campaign and groundbreaking partnership with the BC Lions started with high school students and expanded to address all forms of violence, harassment, and bullying, an initiative that has been truly inspiring for so many. As Parliamentary Secretary for Community Development and Nonprofits, I advocate for the nonprofits within government. I enjoy being a champion for the work social service agencies do for British Columbians. At the heart of every community, nonprofit volunteers and staff work hard to make a difference in the lives of people in crisis. Organizations like EVA BC are directly on the front lines 24/7 in extraordinarily stressful and high-pressure situations with adults and children fleeing violence. Your volunteers and staff do amazing work that is to be commended. We need more organizations like EVA BC providing vital services that create healthier and safer environments for everyone. This year's theme of the annual training forum is strengthening roots and sustaining growth. By sharing excellent social work practices and developing leadership, you are becoming the positive change children and families need to thrive. In my previous life as a lawyer, I worked with Indigenous residential school survivors, work that affected me deeply personally and professionally. I saw how so many organizations across BC on the front lines provide safety for people at their time of need. I've met an incredible array of people dedicated to serving British Columbians. It is humbling to think that 29,000 nonprofit organizations employ approximately 86,000 British Columbians in every corner of this province. I'm grateful to think of all the volunteers and staff members who step up every day to make a difference in their communities. Your work is often behind the scenes and doesn't always receive the recognition it deserves. But we see you. We know how hard you work to serve people despite having to deal with the limited resources and budgetary challenges. It's why government invested $30 million in the Nonprofit Recovery and Resiliency Fund, to which Vancouver Foundation added $4 million. The fund is administered by key sector partners, including Vancouver Foundation, United Way BC, and New Relationship Trust, an Indigenous-led funding organization. The fund will support organizations whose staff, volunteers, programs, and operations have been impacted by the effects of the pandemic, including nonprofits led by equity-denied communities and those operating in more rural areas. We recognize that nonprofits continue to provide critical services and show up for people living in BC in the toughest of times. Over 3,100 applications were received through Recovery and Resiliency Fund, which closed in early October, and we really look forward to announcing the grantees in the coming months. I know in the last couple of years there have been really especially challenging times for people in organizations like yours and on the front lines of the many crises that our communities face. In my role, I'm committed to doing all that I can to help nonprofits and charitable organizations thrive and succeed. When we work together on behalf of British Columbians, we get great things done. Thank you for being the light that continues to shine in every community in the province. It makes me even prouder to serve this sector. I will continue to be a voice for you within government. With your commitment, we will continue to build a stronger.
Thank you, Nikki Sharma, for that hopeful and inspiring message. Just a reminder that as we did yesterday, we'll be drawing a couple more names for prizes later this morning. So we invite you to go to the funding and prizes page for more information about those prizes. I'd like to introduce Erin Whitmore and Samantha Fernandes. These are our two guest speakers this morning. The Executive Director of EVA Canada, and Samantha Fernandes is the Program Manager with EVA Canada. Today in their presentation, Building Systemic Supports for the Sexual Violence Sector to Address the Impacts of COVID-19, they will share the findings from EVA Canada's National Survey of Sexual Violence Services in Canada. In addition to what they've learned about the strengths and challenges being faced by the sexual violence workforce, they will also explore and discuss emerging strategies for strengthening systemic supports in the sector's workforce. Please note that we will have a little bit of time at the end for asking questions, and I invite you to share any questions during and after the presentation in the Q&A section. It's beside the chat section on the right-hand side of your screen. Welcome, Erin and Samantha.
Thank you so much, and good morning to everyone. Thank you for inviting the Ending Violence Association of Canada to speak with all of you today. Myself and my colleague Samantha are really looking forward to sharing our work with you. In our presentation this morning, we've made a few changes, I think, to the presentation since we submitted that title and abstract. So we are going to be talking today about building a national picture to support systemic change for the anti-violence workforce. We're planning on speaking about a number of initiatives that EVA Canada has underway that are aimed at contributing to what we have heard from advocates across the country about the need for a national picture and understanding of the anti-violence workforce in Canada that can be used to identify and promote the systemic changes that are needed to better support our workforce and in turn, better support our efforts at ending gender-based violence. As a national organization, EVA Canada has the opportunity to meet with and hear about the experiences of those working in anti-violence spaces, whether that's a community-based sexual assault center, a shelter, a settlement organization, or any of the many other spaces that we know anti-violence work takes place. Of course, in these conversations, advocates are always focused first on how to best support survivors. However, the challenges that those doing this work are facing is increasingly a common and pressing topic of conversation. And this isn't just coming out of conversations with a single organization or community, but rather in organizations and communities across the country. In the absence of really up-to-date and comprehensive national data that gives us a good picture of the anti-violence workforce in Canada, many of these challenges and the fact that they are so widely experienced remain hidden. And it's often left to individual workers and organizations to address them. So some of the questions that we are hoping to explore today in our presentation include asking, what is it that we actually know about the anti-violence workforce from current research? What are some of the common narratives and perceptions about anti-violence work? How do these narratives and perceptions impact the broader movement to end gender-based violence? And what is involved in rewriting these narratives and the systems and structures that uphold them? As we will explore through this presentation, a common theme that is coming through in the work that we and many other organizations, I'm sure including many of you, are doing in this area is the real need to focus on systemic and structural rather than individual solutions to supporting health, safety, and wellness for the anti-violence workforce. So throughout our presentation today, we're going to be drawing on data and information from three initiatives that we are working on at EVA Canada. And we're hoping that by doing this, we'll be able to provide some more concrete examples and evidence from frontline workers in the field. The first initiative that we'll be talking about is a national survey of gender-based violence workers and volunteers that looks at the impact of COVID-19 on the anti-violence sector, particularly during those early months of the pandemic in 2020. We are also going to be speaking a little bit about another national survey that we have underway that is looking specifically at sexual violence services in Canada. And this survey is really aimed at addressing what we see as a very significant gap in national data on sexual violence specific organizations and workforce. We'll be doing a more comprehensive release of the findings from this survey in the new year, but we'll be sharing some preliminary findings today. And then finally, we're also going to be drawing on work that is taking place as part of our 3-year wage-funded project called Building Systemic Health, Safety, and Wellness Supports for the Anti-Violence Workforce that Samantha is leading. And as you can probably tell from the title, this project is very much focused on the topics that we're going to be describing and talking about today. So before we delve into some of this research and its findings, we wanted to just start off by talking about how we are using the term anti-violence worker and anti-violence workforce. I'm going to turn it over to Samantha, who's going to present our working definition for these terms. And these, of course, are continually evolving and being shaped through the work that we do and the learnings that we gather from organizations across the country.
Great, thanks so much, Erin. I'm going to ask one of the hosts if it's quickly just able to give me the ability to share the screen, to share the PowerPoint, but I'll continue talking and then I can share that as soon as we can put that up. There we go. Okay, great. So let's talk about who are anti-violence workers. And, we really want to acknowledge that if we're looking to change some of the narratives about this work, we want to be able to first define who we are as a sector and who the workers are in this realm of work. And we need to do that in order to be made more visible. So we're defining anti-violence workers as anyone who is doing either paid or unpaid work that supports in the prevention of, the intervention in, or the recovery from gender-based violence and the trauma that comes with it. So this includes, across the areas of gender-based violence, sexual violence, trafficking, domestic violence, housing work, legal support workers, healthcare workers, counseling, administrative work, which we know we all need, research, advocacy, social policy work around gender-based violence. All of these are included within the realm of anti-violence workers. And so acknowledging that workers play a number of different types of roles in a number of different types of settings. You may also have, for example, a settlement organization that has a gender-based violence worker, or a mental health organization that has an anti-violence worker. And so the work is done throughout the community in many different ways. And the key question here is, does this person have routine, repeated exposure to survivors' stories or issues of gender-based violence and trauma in their role? And if the answer to that question is yes, then we are counting this person as someone who is actively doing gender-based violence work and is part of the anti-violence workforce. Now, we know that research on this workforce is very, very limited. Our work is not well understood. It's not well studied. So a lot of the challenges that people in this workforce experience go unacknowledged. And COVID-19 has really provoked a conversation about gender-based violence. And more evidence has started to be gathered about this workforce, some of which we will talk about here. But we know that public perception of what anti-violence work is very different than what the actual work entails on the ground. So, I'm putting up some words that we might use to describe the kind of work that we do. So we know that this work needs a lot of skills. We know it's complex. We know it's rewarding. But I invite you to also put in the chat, if you can, some words that come to mind when you think of what it takes to do this work and what qualities are needed to do this work. There are many different words that I'm sure we can use to describe it. However, we know that the public perception of the work is often that, we're just bleeding hearts who just want to help folks. And we know it's so much more than that. So a big part of what we want to do with this presentation is to talk about how do we start to shift the narratives about who we are as a sector and what it is that we do as a work. I'll pass it back to Erin.
So we want to turn now to look a little bit at some of the research that EVA Canada has done, focusing on the state and conditions of the anti-violence workforce. And so I'm first going to talk about a survey that we conducted in partnership with ANOVA, a women's shelter located in London, Ontario. And this was a national survey of anti-violence workers and volunteers about the impact of the pandemic. And through this initiative, we really wanted to hear from people in their own words about their experiences and what it was like for them as service providers on the front lines during this difficult time. And we'll go to the next slide, Sam. Ultimately, we heard back from 376 staff and volunteers from across the country and across various facets of the sector. Now, we have done some more detailed presentations on the findings from this research. There's also a full report on our website that people can check out. So I'm not going to do an in-depth review, but what I really wanted to highlight for our purposes today, and we'll go to the next slide, are a few examples from the data that we think speak specifically to a growing call from the anti-violence workforce to situate the individual and organizational impacts of this work in broader systemic and structural analyses. I'm sure not surprising to anyone here today, the findings from our survey demonstrated that anti-violence workers during the pandemic were experiencing significant increases in stress, in overwhelm, in fear in some cases, and complexity in their work. And yet, if we look at some of the stories and explanations that people who filled out this survey shared, we see that workers were really trying to resist this idea that that this additional stress, these additional complexities were individual problems or failings, and rather we're focusing on repositioning these as an understandable reaction to doing this work in a broader system that doesn't fully value and recognize that work. So we'll take a look at one comment here shared by one individual who filled out our survey on the next slide. And so this person offered the following: if I'm awake, I'm working. It doesn't feel like there is any downtime. On top of regular work, there is all these other changes we have to look at, implement, and ensure are being followed. An overwhelming amount of information is being thrown at us from the province, the federal government, our funders, the ministry, public health, and other sources as well. No vacation at all or any days off. Every day is a work day. Exhaustion. I work in an extremely supportive environment and I have a supportive home life. And yet this is the most stressed I have felt in my 25-year career in this sector. And so again, while this person is talking about the personal and individual impacts of anti-violence work that they are experiencing, if I'm awake, I'm working, it doesn't feel like there's any downtime, exhaustion, and so on, she's also making some really important and valuable connections to the structural realities and contexts that are at the root of these personal experiences. As she says, an overwhelming amount of information from the province, the federal government, and so on was being thrown at her. It's interesting as well that in this offering, this person makes the point, I think, that is really common across much of the data that we have seen, in that as someone doing this work, this person is making an effort to create personal and organizational supports. As she says, I work in an extremely supportive environment and have a supportive home life, but it's these bigger systems and contexts that continue to create challenges and complexities. And we'll look at a couple other examples that make similar points. So the first quotation on this slide, this respondent writes, "We are all struggling, survivors and advocates, our children, our families. We will remain underfunded and underappreciated. Domestic violence is not going away within this structure we live in. We can't go back to normal. We need to change the way we do things. This is not sustainable." And then the second quotation on the screen, I certainly think there will be issues in returning to normal, and this shift will occur slowly. However, I think framing it as a return to normal is incredibly problematic because our normal before the pandemic was not serving women who experience violence well. I think we ought to look at this pandemic as a learning lesson in the bigger picture of gender-based violence. So again, in these two examples, both individuals similarly make really important connections between the systemic, the structures we live in, as they note, underfunding, underappreciation, the lack of sustainability, and the individual. And I think also they're making that connection not only in terms of the individual impacts on themselves as workers, but also on the survivors that they are working with. They also make important observations about the toll of working in ways that seem at odds with these bigger goals that we all hold of ending violence. As they know, domestic violence is not going away in the structures that we live in, and our normal was not serving women who experience violence well. Again, though, really importantly, and what we want to emphasize in both of these examples, the solution that these two individuals are offering is not individualized solutions. They're really emphasizing that what is required is a systemic and structural change. We can't go back to normal. They say we need to change the way we do things. We need to look at this pandemic as a learning lesson in the bigger picture. So these are just a few examples from our research and on the impact of COVID on the anti-violence workforce, but we also want to acknowledge that there is a much broader body of research emerging within the nonprofit sector more generally that is similarly really pointing to this need to examine some of the systems and structures that within which our work is taking place. So in the next part of this presentation, we want to kind of unpack what we mean by these systems and structures and talk about some of the main ones that are emerging from the research and what they look like specifically in the anti-violence context. We're going to start, though, by giving a bit of a case study so that as we talk about some of these bigger systemic and structural factors, which can sometimes be a bit harder to wrap our head around, we can really kind of stay connected and grounded in a picture of how these show up in our day-to-day work.
Great. And so to do that, I'm going to introduce you to a young woman named Charlotte. I'm going to read out her story. And as I read it out, I invite you to think about what are some of the factors that you're seeing in her story that are impacting her well-being and her current state of how she's experiencing the work. So Charlotte is an administrative receptionist at a women's crisis center who works 4 days per week. She would love to work full-time for the center as she really enjoys the work, but she knows that they've been struggling with fundraising and they can't afford to give her the extra hours. In her role, she answers the phones, she books appointments, she greets clients at the front desk, and distributes gift cards and vouchers to clients in need. Charlotte sometimes sees women come in with bruises or injuries, and she often finds herself consoling emotionally distressed clients on the phone before they can even speak to an intake worker. Charlotte regularly leaves her job at the end of the day feeling emotionally drained. She is constantly worrying about clients from the center outside of work hours and while working at her other job, which she needs to make ends meet. Being a part-time admin worker at the center, Charlotte is excluded from clinical trainings and supervisions that other frontline staff attend, and she does not have EAP benefits that would allow her to access counseling, despite having worked at the center for over 6 years. Charlotte has also been feeling stressed lately because her rent has gone up and she will need to take on overnight shifts at her second job to manage her bills. So thinking about Charlotte and her story and the predicament that she's in, let's start to talk about what are some of these factors that are affecting her. And so recent research really points to the need to understand the interconnectedness of all of the different factors that affect individual workers. So on the one hand, we know there are individual factors that are unique to different people. These may be things like the impacts of trauma exposure that we see in our regular day-to-day work. We call these many different names. There's vicarious trauma, empathic strain, compassion fatigue, secondary traumatic stress. All of these are different ways to describe the types of impacts that happen as a result of doing ongoing work with victims and survivors. There's also, your support system, your ability to set boundaries. All of those are individual, unique factors. We saw some of these in Charlotte. She's clearly being affected by the interaction she's having with clients. She's taking it home with her, worrying about clients outside of work time. So all of that is happening for her. We also see some organizational factors. So these are things like policies and procedures that organizations set for themselves, the culture of the workplace and the organization, leadership capacity. All of these things have direct and indirect effects on workers themselves. And we see in Charlotte's case, there's, the inability to access the clinical supervision or adequate supervision. There's struggles with funding, her inability to increase her number of hours. All of those things are things that organizations may be struggling with. And then there are the bigger picture systemic factors. So these are things like the larger labor market trends, the prevalence of precarious work in our sector and in our systems, the perceptions of what care work is, myths and stereotypes about what anti-violence work is. All of these things also come into play in affecting someone like Charlotte in her work. So we want to look at some of these really deeply embedded systemic and structural factors. That's what we'll be focusing on over the next few slides. And we know that the pandemic has really exacerbated a lot of the problems that were pre-existing in the sector. So whereas, prior to the pandemic, Charlotte may have still had some struggles, after the pandemic, a lot of those may have really gotten worse or become exacerbated. So let's talk about some of these systemic factors. First of all, the gendered composition of our workforce. So the anti-violence workforce is predominantly women identified. We know that there's an Imagine Canada report that cited that 77% of all nonprofit employees identify as women. When you compare this with employees across the labor market, 49% of all employees economy-wide were women. So clearly in the nonprofit sector, there's a majority female workforce. There is no specific data for anti-violence workers, but I think we can assume that it may be higher percentages of women in the anti-violence workforce. And so to make the point that, because this workforce is predominantly female, issues and struggles and challenges that are happening in this workforce ultimately are gender equality issues. And then labor that is traditionally coded as female is often minimized and devalued by our social system. So living within a capitalist, colonial, patriarchal system, we know that feminine work, female work is often trivialized and minimized and not seen as valuable in comparison to, let's say, working in finance or working in business or, working in advertising, marketing, all of those fields. So there's the minimization of this work. We know anti-violence work can occur in very informal grassroots settings sometimes. So wanting to acknowledge that GVV work is done in many ways by many people, including by non-binary and by gender diverse people. Sometimes this work is done in very non-formal, unprofessional settings or spaces in community centers, in backyards, in all kinds of areas. And it's often done by volunteers as well. And so all of that work goes largely unrecognized. And lastly, COVID has really highlighted the importance of care work and the disproportionate impact on women of this pandemic. So there's a report from the Standing Committee on the Status of Women that identifies a lot of statistics around this, that women are overrepresented in many frontline workforces, that their health has disproportionately been impacted by COVID. They've had more exposure to COVID, their mental health is much lower, but there's been little action taken on really how to address these disproportionate impacts.
So a second theme that is emerging from the research and analysis that looks at some of these systemic factors that is particularly relevant for the anti-violence workforce is the way is focusing more on the language that is used to describe the work that we do. And some good examples of research that has been done in this area come from both Imagine Canada, the organization Imagine Canada, as well. EVA BC has done some really important work in this area, and I'm just going to talk about two pieces here. So in a report recently released by Imagine Canada on the nonprofit sector, they really spoke about the importance of making this connection between the predominantly women-identified workforce and the devaluing of that labor performed by that workforce, in part because it is perceived in stereotypically feminine ways. That is to say that it's seen as work that, is dependent, nurturing, caring, emotional, unintelligent, unskilled, and requiring guidance and monitoring. In a report that EVA BC prepared in collaboration with the Federal Ombudsperson for Victims of Crime, they looked specifically at the ways that this manifests in the anti-violence context in particular, and made some really important connections between really highlighted the contrast between the way that anti-violence work is perceived and described and the way that the work of first responders is perceived and described. So in contrast to the work of first responders that is associated with traditionally masculine language, such as strong, brave, and heroic, community-based anti-violence work is again framed in ways traditionally feminine terms defined by things like sympathy, compassion, and interpersonal connection. So again, while this is something that's being really named and explored across the nonprofit sector, we also want to think about why this is particularly problematic in the anti-violence context, and we'll just go to the next slide. And one of those is, again, the fact that minimizing and trivializing the labor that anti-violence workers perform simultaneously minimizes and trivializes violence itself and its impacts. We also know that these more dismissive and trivialized characterizations of anti-violence work are inaccurate, as Sam spoke about earlier. Anti-violence work is multifaceted, complex, skilled, at times dangerous. One of the strategies that current research is suggesting and that we are exploring in the work that we're doing is to really more comprehensively document what it is anti-violence workers do and the impact that they have. With the absence of these realities not really being captured or conveyed, these common perceptions and language that are used outside the sector persist.
And so if we look at the relationship between these public perceptions and the material realities that nonprofits actually face, we can see that sometimes these perceptions provide a justification for inadequate funding and resourcing of gender-based violence programs and services. So again, a quote from Imagine Canada that points out the links between the stereotypes and the approach that the sector faces, that is underfunding, excessive monitoring, and not being taken seriously by government or by the public. So there's the perception that anti-violence work is stereotypically feminine, which is less valued. And we see this in, on a day-to-day basis with folks like Charlotte, for example, in her case, administrative work is devalued. Working at a crisis center or women's center is not seen as having a whole lot of value. And therefore it leads to justifications for, lower funding. But at the same time, I want to point out that our fight for funding and for recognition is also a part of how we push back against the system and how we advocate for gender equality. And it can sometimes feel like pushing a boulder up a hill, but it is a very, very important piece of the work. So let's look at how this translates at the sector level. So we see a lot of differences in core funding versus project funding. Many nonprofits, especially in gender-based violence, really struggle with obtaining a core, sustainable, long-term funding to support their services on an ongoing long-term basis. A lot of grant-based funding is very much specific to projects. They are time-limited, short-term, 1 year, 2 years, 3 years. And so what that leads to is a lot of elaborate and time-consuming reporting and application processes, constantly looking for new grants, constantly chasing more funding, and all of that time is being taken away from doing the direct work and the direct service. It also creates and reinforces a very reactionary and uncoordinated workforce or sector. So having scattered funding can translate into a scattered sector. Projects start and they end, they start and they end because of funding that just runs out. And so there are a lot of ways in which things become less cohesive as a sector. And then there's the ongoing consequences of historical underfunding that has really led to a scarcity mindset in the sector. So a lot of organizations are constantly operating from the standpoint of there isn't enough, we have to do less, we have to do more with less, we can't spend this much on this, and constantly looking and budgeting and looking and budgeting. And so that scarcity mindset kind of underlies all of the operations of the organization. And at the organizational level and the individual worker level, we see a lot of inconsistencies with salaries, with benefits, with pensions, with non-monetary benefits and supports that workers have, sometimes in the same organization or in the same city or the same town or the same region. People end up doing the same work, but being paid very differently. We have a lot of discrepancies around that in the workforce. There's a lack of professional development opportunities. Again, this work is often seen as something that people just do out of the goodness of their hearts, and is not seen as something that takes skill and education and training to be able to do. There are very few occupational health and safety supports. So looking at issues like vicarious trauma and compassion fatigue, empathic strain, all of those things are occupational health and safety concerns. They are a direct result of the work that we do on the front lines, working with clients, hearing client stories that impact our psychological, emotional health and well-being. And so they should be seen as health and safety concerns as opposed to just a not enough self-care kind of concern or issue. But there are very few occupational health and safety supports often in place in community-based organizations, especially in smaller organizations, because the resourcing for those things are just not always available. There's also moral pain and ethical pain and distress, which is really just the feeling of when you're trying to help folks who need it, but you can't due to systemic barriers. So having to turn a woman away from a shelter, or seeing people continually living in abusive relationships because they just can't find adequate housing. It leaves workers with a lot of moral distress, and that can really take a toll on their emotional and mental well-being. And then there's competition for human resources with public and private sectors. So there's, nonprofits and community-based agencies are often seen as a training ground for folks coming into the field, getting trained, getting some experience, and then moving into other sectors such as school boards or hospitals where they can get better benefits and can get better pay. So the competition with these other parts of the sector are very difficult to manage for nonprofits as well.
Great, thank you. And Sam, I think we'll just skip to the next slide because we're just over time. Just in conclusion, as a national organization, in our role as a national organization, as we said, we have the opportunity to hear from anti-violence workers across the country. And these challenges that we have raised in this presentation are ones that are common across all communities. Continuing to draw attention to the national scope of these challenges is really important in order to promote broader commitments to addressing this issue. EVA Canada is working with other anti-violence advocates and organizations across the country to press government to recognize that the needs of anti-violence workforce and organizations are included in federal policy and budgeting, including in the National Action Plan to End Gender-Based Violence, which some of you may know was released earlier this month. The National Action Plan, as it was released, provides very high-level recommendations about the issues that we've talked about today. And over the coming weeks, we, along with many organizations, are going to continue to press for more concrete measures and commitments related to the needs of our sector and its workers and volunteers. We wanted to share this quotation just as we end our presentation. because I think it serves as a reminder of what anti-violence work and workers create, the expertise that we hold, and in determining ways of working that really do challenge the status quo, that resist that return to normal that we talked about at the beginning of this presentation. This is a response we received to one of our research initiatives in which this worker writes, "I credit our ongoing work to be a trauma-informed organization for this success. My experience of my workplace was as an anchor of safety, empowerment, collaboration, trust, and choice, even as COVID provoked fear and created chaos in seemingly every aspect of our lives." And so Sam's just going to speak a little bit about her project.
Yes, and so just in wrapping up, we want to acknowledge that this is difficult work, and we need to do a lot more work to make this a better environment for our workers to be in. And so over the next 2 years, EVA Canada is going to be working through a project called the Building Systemic Health, Safety and Wellness Supports for the Anti-Violence Workforce. And in this project, we'll be collaborating with our National Gender-Based Violence Worker Wellness Advisory Committee to generate some national data to describe the challenges. And hopefully we will use this to be able to develop some concrete recommendations and strategies to implement systemic change within this area. So that's what we're hoping to do. And our contact information is up on the screen in case anyone would like to reach out to us about this. And that's it for us. We're just going to wrap up here.
Thank you so much, Erin and Samantha. We have a quote here that I just wanted to read out loud. I just wanted to say thank you for bringing forward that someone is listening and acknowledging the reality of anti-violence work. Seeing this in writing and hearing it talked about is extremely validating. Thank you. So we're going to open up some questions.
Thank you for that. And I think that's part of what we're hoping this project will allow, will be a space for sharing some of these stories and experiences so that people don't feel isolated or that their work is, not visible.
So one of the questions is, it's so powerful to see anti-violence workers from a narrative perspective. You probably will speak about that later, but I'm curious to see what are some of the ways we can support anti-violence workers to reauthor their experiences?
Yeah, and thank you for that question. It's a lovely way to put it. How do we reauthor these experiences? One of the things that we're, really starting to see more and more coming up in the discourse is about collective care and what we need to do to take care of each other in a system where, in a system where there isn't recognition of the work, or where it's a constant struggle to take care of ourselves and our wellness. How do we take care of each other? How do we show up for each other? And what do we need to do to enable organizations to put that to the forefront as well, and support them as they try to take care of their workers? And Erin, if there's anything you'd like to say.
No, that's great. And I do think that I appreciate that comment about just using stories and narrative, because it is a really powerful way to convey the real nature of the work that happens in anti-violence, and the way that public perception, is so different from the work that is actually happening. So through gathering stories, and of course, we always appreciate the willingness of people to share those stories through some of these initiatives, I think we can really start to tell some different stories about the realities of this work, and think critically about the language that we use when we talk about anti-violence work.
Thank you. Another question. We know that this is the widespread reality for a lot of anti-violence workers, but do you think it's feasible to coordinate a widespread response for change, or is this more organizational specific? If yes, How can we start seeing this as a possibility for our sector?
Mhm.
Yeah, I mean, I think that that is one of the things that we've been thinking about as a national organization. Often we're in situations where we hear, as we said, these stories from so many different communities and organizations, and there's a real power in articulating them in a way that shows that this is a national issue. And that the lack of support for anti-violence workers, who really are, if we want to use the first responder language, the first responders to the public health crisis of gender-based violence in Canada. I think that the National Action Plan to End Gender-Based Violence is one attempt to draw attention to the need for coordinated and consistent resourcing for anti-violence workers across the country. And certainly that's something that, we're continuing to do work on. It is challenging. We know there's a lot of differences in different communities across the country, but I think continuing to develop and promote an understanding that this is a widespread problem is a really important first step in making some systemic changes.
So thank you again so much, Erin and Samantha, for the really important you're doing.